This is Dr. Vaishali and I'm reading from the book Substance of Homeopathy, chapter number 28, the period 4, first line of the metal. Medicine is cuprum metallicum. As far as cuprum is concerned, the main mental picture we get is the feeling of being attacked. The rubric are fear of being approached, child cannot bear anyone coming near her, or delusion that she is pursued by the police, striking, shrinking, beating, etc., which come in attack. Similarly, in the cuprum general state, we have spasm, convulsion, and violent phenomena which occur suddenly, periodically, and spasmodically in attacks. At the same time, we also have in cuprum the need to perform. For example, we have the rubric delusion he is an officer, delusion he is a great person, delusion he is a person of a rank and he is a general. On the other hand, we have a single symptom of cuprum like delusion he is selling a green vegetable, delusion he is repairing an old chair. For a long time, I was wondering what exactly this delusion means. And then I understood that the selling green vegetables and repairing an old chair indicate very ordinary occupations, and cuprum needs to be much more than that. He needs to be a person of the rank, a general, or the officer. He has fear of being attacked, and therefore he needs to be general. So, the two aspects of defense and performance again come out quite clearly in the cuprum. One remarkable case that I remember was of a little girl, age of 3 years. She was dragged into the OPD of the hospital where I worked by her mother, and she was shrieking and screaming. And each time I would like at I will look at her and she would scream more loudly. This girl was a complete wreck, only skin and bone. Means very thin. She could hardly stand or walk, and I had serious doubt that she would ever recover. She would sit on the floor of the room, would not look at anyone, and if anybody went near her, would scream and kick, bite and spit, and make angry faces. Over the next 3 4 years, we gave the cuprum and the she improved very well, and she put on the weight and was able to go to school. Her behavior improved and she showed very good progress. The main theme of the cuprum seems to be attack and defense, not a constant vigil as one would see in the zincum, but rather a paroxysmal and violent phenomena, a feeling as if one is being attacked, and for that moment he has to defend himself violently and vigorously and impulsively. This theme emerged clearly in the following rubrics: biting, shrieking, striking, tearing, violent rage leading to violent deeds, wildness, rage in paroxysm, croak like a frog, bellow like a calf, and delusion arrested he is about to be, home desire to go, fear of stranger. All these rubrics give us the theme of cuprum: attack when you are attacked, or strike back quickly when attacked. This theme can be seen in many ways, as in a martial art like a karate, and no wonder lot of cuprum people are attracted by this such activity of martial art and karate and all this. In the physical sphere, too, the same theme emerge. An example: violent paroxysmal brought on by exciting factor. The cough of the cuprum is typical. It has a paroxysmal coughing in a long, uninterrupted paroxysm, which definite exciting factors such as 3 a.m., moon phase, emotional excitement, etc. The cough is like a convulsion, a condition for which cuprum has much reputation. This is easy to understand why, since we have already seen the theme of cuprum to be a paroxysmal, violent with shrieking, etc., which is the typical feature of the convulsion. Now the medicine is zincum. Zincum, the remedy next to cuprum, has very similar feeling. It has also the feeling of being attacked. In this remedy, the rubrics are: delusion thinks is accused, delusion thinks is about to arrested, thinks is to be murdered, pursued by police and enemy, rage, escape attempts to is restrained with difficulty. I found that the Zinkum patients have a tremendous constant anxiety as if they would be arrested, as if somebody is behind him. The difference between cuprum and Zinkum is that cuprum has a periodic attack of the tremendous anxiety, while it is a cuprum is a remedy which has the feeling it would be attacked, whereas Zinkum feels somebody is constantly behind him, and this causes a constant restlessness which is manifested commonly as a restlessness of the lower limb. And in the rubric Korea while at rest, he can never ever remain still. He is always fidgety and moving, and in very severe cases, I found that these people have a criminal look on their face and feeling as if somebody is going to come from behind them at any time, and this keeps them alert, stiff, and tense. Zinkum people are good performer as well as like a cuprum in the as well like cuprum in the physical sphere. The main symptom of zinkum is that every sickness, every infection straightway affect the brain and the nervous system, causing a tremendous excitability and restlessness. For example, even the measles infection would directly affect the nerves instead of the appearing on the skin or even the lungs, and thus cause severe complication like convulsion or late sequels such as subacute sclerosis or subacute sclerosing panencephalitis panencephalitis. After a period of excitability of the brain and tremendous restlessness, the zinkum patient can go to the extreme, which is a tremendous dullness, fake out feeling, such that he cannot even understand the question. He repeats the question before answering them. He is a muddle and has brain fag. And these two extremes of zinkum, the ability to defend and collapse, are two parts of this metal. We can see now how zinkum is closely allied to nicoloum, which is in turn close related to ferrum. Now next medicine is manganum. Case of manganum. I had a case of a man, age of 23, architect. He couldn't walk because of his disease. He walked with a stick and had come alone. He sat straight, not relaxed, and was frowning. His chief complaint was stiffness of the joint with the pain. His knees, ankles, shoulder, and back were affected. It started in the 1979 with pain in the right leg. It started capturing my body. In the last 13 years, most of my joints have become affected by arthritis. He also has an ankylosing spondylosis. And he said, I feel I am imposed on my mother. This is what I think is my problem. Then I asked, what is your nature? And he said, I don't speak out things. My mother has a military way of behavior. I fear her. I cannot cope with my mother. I feel she will not like what I do, will not approve. I feel like taking revenge on her. If she does not like me to lie on the bed, I feel like doing it to spite her. But I cannot do it. Every morning at 6 a.m., his mother puts on the radio with the loud music and it disturbs his sleep. And I feel like telling her, shut off that radio, but I cannot even tell her. I feel like breaking the radio. He is the only child. His father died in 1980. They used to live with the father's parents and siblings, and the mother was dominated, suppressed, and harassed by her in laws. They had moved out from there, but the mother kept brooding and complaining about all things that used to happen. She talk about the past all the time, and she does everything she like, but I cannot do it. Sometimes I feel she is not my mother. That was the important information in this case. And the follow-up was the patient was follow up with colleague for the last 3 months, and the colleague has now brought the patient back. The patient has taken the remedy in December and improved. When I asked how he has been since December, he said without the frown, the pain has subsided. I have more confidence in my life. I feel I will be able to walk, and I hope for it now. The swelling in his left knee is less. and difference was observed that the swelling of the all joint are 20% better. He's asked about his mother, and he said because of the attack she had a phase in that family, she started to impose on me. I have a furious feeling within me all the time. Maybe it is this feeling that is coming out in the form of joint pain. So then I asked, what did you do with this feeling? And he agreed he felt dominated. This how the fury started, and how did you express it? That was my question. I never expressed it. I never talked with my mother. I felt I was suppressing myself. I cannot come out with my thoughts. I should have come out with my thoughts, but I couldn't. I felt she should not be doing what she is doing. In January, I don't know why, I told her, you should not put on the radio so loudly, and she listened to me. He looks happy. She replied, listen to me, and reply and really listened to me, and I wanted to make some changes in the house. She said, here is the money, and go and make the change. For the first time, I feel she's my mother. And analysis was what? I shall now explain how I looked at this case. His mother is troubling him, dominating him, and pushing him down. The feeling in his mind is to take revenge. He feels fury but cannot express it. He has to suppress it. He is offended. He hates her, and she is not my mother. He feels revengeful, malicious, and violent, but cannot do anything. So, what does he do? He sulk, frown, becomes sad and reserved. The theme is a chronic feeling of being dominated, suppressed, and harassed. Constantly, someone is pushing me down. Is he insulted? No, his ego has not been affected. This is not staphysagria. There is not the sensitivity of the staphysagria. His joints are being eaten away. This is a chronic slow eating away process, and he become a bitter and sad inside. He feels like attacking, taking revenge. He want to fight back in defense but cannot attack. He always suppressed his violence. He puts up a wall. He becomes sad and embittered. And on the other side, he doesn't react, attack, defense, and this chronic state indicate a metal, but this metal is not as heavy as a mercurius. It is not syphilitic. It is more psychotic. The situation is not desperate at all. There is no suicidal thoughts here. He feels harassed and has to defend himself. He has to be strong to put up with things. The main theme of this remedies is suppression, and the remedy is manganum. In the periodic table, it comes next to the ferrum, and rubrics are malicious, hatred and revenge, violent, hatred of person who had offended him, reserved, quiet disposition, morose, conversation aggravate, mildness, irresolute, timid and bashful. I want to take revenge but I can't, frowning, sulky. Manganum has a bitter sadness, a deep-seated bitterness. Clark described it as a rancor, means extreme hatred. The rubric is embittered. The patient was asked how he felt about the music. The sad music affected him greatly. Sad music brings out sadness and relieved it. He likes to like the saddest song. Sadness of the music or sad music ameliorate her, and music aversion to joyous but immediately affected by saddest. Manganum is the only remedy. According to that, the homeopathic principle, sad feeling will be relieved by sad music. The reason why only manganum is mentioned in this rubric is because the feelings are so suppressed in manganum that only music with the same depth of the grip can touch them or relieve them. They are quite reserved, morose, especially with the person who has offended. The mother also needs manganum. She was harassed, dominated, and suppressed, and she kept it all inside, and she couldn't express her feeling living with her in-laws. Other suppressed remedy express their pent up feeling sometime. For this example, Staphylococcus, which has violent outbursts of the anger, but the manganum never expresses feeling. So music relieves and brings out this feeling. Music brings out emotions, our suppressed feelings into the conscience. Manganum is unconditional relief by the saddest music. Stephsagria is suppressed too, but the ego is involved. There is a morbid sensitivity and the scar form. Manganum is a gradual, slow, deteriorating process like arthritis, muscular dystrophy. It is very close to the pharum. The feeling of being dominated is also the pharum, being forced to do something against his will. Pharum and manganum are next to each other in the periodic table. 1 month earlier, the patient had felt he should meditate, and the medicine helped him to do that too. In the past, there had been too much in his mind. On the next follow up, he came without a stick. The pain has subsided. He is feeling much better and has started walking again. He thinks he is a 50% better. My dreams are much less. What are your dreams? I asked, and he said there were three types. One, I was falling from the high building. In another, it is as if I am late or unprepared for the exam. And in the third, I am traveling on the train. I have a ticket, but the collector says I don't have a ticket. Now I dream of a daily event. I have calmed down a lot. I used to think all the time about my mother. Now I see that she does it for everything, everyone's good. And before I show her as an enemy, I wanted to take revenge. I couldn't stay in the same room and make conversations. She has changed toward me. Now we do things together. Now he cannot work. He cannot work, drive out, about, visit places. Previously, went out only to visit the doctor every 10 days. He has been given manganum 10 m, one dose again, and manganum is not a suppressed anger. It is a totally suppressed. Not only anger, the mother shows the hard dictatorial side of the manganum. The son is the suppressed side of the manganum. The theme of the attack and defense, which generally indicate a metal, are also seen here. Now I am explaining the manganum picture. Shy child of the dominating parent gets the idea that his parents are not looking after his problem and develop a feeling of bitterness. Bitterness, shyness, and because of excessive domination, the child develop a lack of self-confidence and feeling all the time inferior about the self and easily frightened and anxious. In a boy, the first major fight is about sexuality, the guilt of masturbation and emission. They become weak and nervous and can't concentrate as if something bad is going to happen. In the presence of their dominated parent, they become nervous, tense, and jittery. At the same time, having a feeling of bitterness towards them and also discontent about themselves and the situation. This led to a period of the brooding and where they are thoughtful, absorbed, and thinking constantly about themselves and sad, silent, inward weeping, low-spirited, reflective, peevish, taciturn, and dull. During this phase, with internal sadness, they respond well to sad music and which seems to be in a tune with their sadness inside them. Like causticum, they may find sympathy for others, and because they find something similar to themselves, there is a sense of isolation, as if nobody cared for them. They are bit better by expressing themselves, though they will rarely do so. They try to get over this by trying to please others and getting gratitude and recognition. They are as submissive and sensitive as Pulsatilla, as anxious as Thuja, and as timid as Cilicia, as sympathetic as Causticum, and as much relieved by music as a aurum. Physically, they may throw out psoriatic eruptions which are worse in the winter or a chronic eczema. These eruptions are inveterate and they may develop a hoarseness of the voice. Constipations, various muscular pain or sprain, and the headaches. They are careful, eager to make a good impression, and thus hardworking and do a good job. They are very emotional people and sentimental too. They are worse in the closed room and better in the open room. Next remedy, the next case is of cobaltum. Mr. G, a vendor, age of 27, came to me with the 12-year history of a photosensitivity dermatitis. He had a rash on his face, which was aggravated by the sun and light of the sun. He had taken a steroid in the past, which gave him temporary relief. Symptoms were cracks on the tongue or either side of the midline, dream of danger as if falling into the veil, timidity when speaking to others, strong feeling of guilt, sensitive if his fault are noticed or pointed out by the others. If my ways are pointed out, I am very sensitive. He has a tremendous sensitivity of the mind and the skin to the people and to the sun. He can't talk, communicate, and blame himself. Rubrics chosen were confidence, want of self, reproach himself, crack on the tongue, sun aggravates, which is mentioned in the Fatak repertory. The remedy which emerged was the cobaltum. Delusion he is a criminal and that others know about it, which is mentioned in the synthetic repertory. He always has to be careful to defend himself. The patient was given cobaltum 200 and he has responded very well. The skin has cleared about 80 to 85%. I had not been so clear for 12 years. The same theme is in the cobaltum. Defense from the attack, from fault finding, and cobaltum has to be a faultless. So in this way, I understood the cobaltum and then I could understand the theme of manganum, ferrum, cobaltum, nicolam, cuprum and zincum, which are the metal of the fourth period. I could see that this metal have a common theme which is defense and performance. A feeling as if the person are getting into their territory and need to keep them out. The need to defend against the attack of others and also to perform. These themes of metal can be easily understood because in the world too, a metal is used for its performance and for the defense.